Good ta, ma'am, ha? Kayat lang, ma'am. Good morning, ma'am. I'm intern Honey Leong. What's your name, ma'am? I will be performing a physical examination of your ears and then your nose, and then next will be your oral cavity, and lastly would be your neck. We'll be using instruments to insert to those areas. Okay, Rani mo, ma'am? If you have questions or if you feel uncomfortable during the procedure, you may interrupt me anytime. Before we start, make sure that the head mirror is opposite your drop light, and the drop light should be on one side behind the patient. Your legs are parallel to the patient so as you won't straddle the patient, and make sure that your eye can see through the hole of the head mirror. Disinfect your hands prior to examination. We will start by checking the ears externally. So we will look for any masses or lesions, hematoma, or signs of skin cancer. So pull the auricle back. We will be checking for any discharges and also the patency of your ear. And then we will palpate the tragus for any tenderness. Ma'am, naay na bating sakit. So we will also check the area for any lesions. So I will be inserting this otoscope inside your ear. So let me know if you feel any discomfort or any pain upon insertion. So in holding your otoscope, you hold it in a pencil grip position, and you anchor a finger or two on the patient's cheek so as not to push the otoscope inside upon examination that might cause trauma to the eardrum. So ano lang ta, ma'am, ha? So in adults, we usually pull the auricle upward and backward so as to straighten the ear canal. So ma'am, ako lang i-insert ang otoscope. Ina ko if na kayo na-feel na sakit, ha. Ma'am, ako rin koon, ha. Ina ko if may sakit. Okay, normal lang, ma'am, or kung nakita ang any deformities. Ma'am, for the tuning fork test, there will be 2 tests to assess for any hearing loss. So I will be starting off with the Weber's test. So I'll be asking you if you hear the sound equally on both sides or it's louder on the other side. Okay? So, equal ang sound, ma'am, or mas loud sa other side? Equal. For the release test, this is another test to assess your hearing. So, I will just be instructing you while I do the procedure. Hindi ko, ma'am, if nawala na ang sound. Which was louder, ma'am, katong first or ang second? Another method of checking your release test is by starting off on your air conduction and then after a few seconds, transferring it to your bone conduction. So, ma'am, ako rin ikuan, mag-test ko usog and then ingon na nako if akong ibanhin siya, then i-note lang if kinsay mas kusog. Okay. Asay mas kusog ato, ma'am? First. So, wala kay problem sa imong hearing, ma'am. It's both normal. I will now be checking your nose. So, first, I will be checking for any gross deformities, any masses or lesions or discharges. So, ma'am, okay ni mo muhikap ko sa imong nose. Then, ingnar ako if you can feel any pain. So, is there any congestion, ma'am, or anything on your nose? Wala lang. Okay, thank you. I'll now be checking your nose internally. So, I will be placing the speculum inside your nose. So, if you feel any pain or discomfort, let me know. So, in holding your nasal speculum, you hold it using your dominant hand because the non-dominant hand is used to adjust the patient's head. So, make sure that your index finger is anchoring on the patient's nose so as not to push the speculum inside that might cause trauma. So, ma'am, insert lang ko ha. Inara if naisakit. Di ka mo anak din, ma'am. Naisakit, ma'am. Okay, and then you open the speculum once you're inside. So you check for any masses or any discharges inside or deformities. Withdraw the nasal speculum with blades partially open to prevent pulling of nasal vibrissae. So, ma'am, ako lang i-withdraw ha. Ina ko isakit. For your nose, you don't have any congestion, no deformities. Nasal septum is midline, no masses, and no discharges. So, ma'am, I'll now be checking your mouth, your oral cavity. So, I'll be using a tongue blade to displace your tongue, and I'll be asking you to do some maneuvers in a while. So, ma'am, okay, open imong mouth. Okay, so I will be checking your teeth. It's complete. And then the sides of the tongue. And then also under your tongue for the vessels. Okay. And then ask the patient to protrude the tongue. Okay, ma'am. Pwede niyo mo ipagawas imong tongue, ma'am. Okay. This is to check for the mobility of your tongue. In checking the oropharynx, ask the patient to open the mouth, ma'am. Open na sa mouth, ma'am. And then, okay ra, ingon ra og Okay, thank you. So, no tonsillar swelling, no masses or lesions on your tonsils. I'll now be checking again inside your mouth. Then I will be using the tongue blade again, but I will be inserting this at the same time. So, if you feel any discomfort or pain, don't hesitate to stop me. Okay? So, in your posterior rhinoscopy, you introduce the nasopharyngeal mirror inside the mouth to visualize the nasopharynx. You use your left hand to depress the tongue using your tongue blade, and your right hand to introduce a pre-warmed mirror facing up. So, this should be above the tongue blade. So, ma'am, open na ta sa imong mouth. Okay. Okay. So, ask the patient to breathe through the nose. Ma'am, ginhawa sa ilong. No masses, bleeding, or discharges. So, ma'am, I'll now be checking the insides of your mouth. There might be a slight gag reflex if ever it's sensitive, and if ever you feel pain or you feel uncomfortable, don't hesitate to stop me so we can rest for a bit. So, ma'am, okay ra mo lean ta forward and then you slightly lift your chin. Okay, that one. So this is your sniffing position. So using your left hand, use your middle finger and your thumb to grasp the tongue and your index finger to retract the lip. So your right hand will be used to introduce a pre-warmed laryngeal mirror facing down. So ma'am, open na to sa mouth. Okay. Ma'am, moingon na ta og E. Okay, okay. Okay, thank you. So, intact ra ang vocal cord mobility and no masses and lesions. So, ma'am, I'll now be inspecting your neck. Okay, so I'll be checking for any deformities, masses, or lesions, okay, or any obvious skin changes. Ma'am, ako lang ipalpate imong neck. Okay ra if it tilts nimo pataas gamay imong head. Okay, like that. So I'll be checking by manually on both sides so as to compare any deformities. Okay, or something else and stuff. Okay. Is it okay for you to slightly tilt your head forward? So palpate for any inflammation or tenderness, and also for lymphadenopathy. So I'll be checking the cervical lymph tissues. Then check the lymph nodes. We have your deep cervical lymph node. Then your submental lymph node. So next we check for the thyroid. So we assess its consistency, its mobility, and then also its size. So ask the patient to swallow to assess the mobility of your thyroid gland. Ma'am, okay ra tulon, ma'am? No palpable lymph nodes, non-palpable thyroid gland.